to join the class, because usually you can join the class without asking me for permission. But when that process happens, I get some type of, they put me on hold. Something is going on. I don't understand what's going on. Do you guys see the hold on screen? See it right now. I have it again. That like something is going on. Nobody? Anybody sees like a pop-up screen saying, hold on, that something is going on? No? Okay. The day of expiration, remember expiration day is very important. Oh no, something is going on right here. Somehow something is going on. Oh no, this is really bad. I don't see. Hello.
Hello.
Here.
You guys still connected?
Yes.
I'm having some type of, issues here that let's continue. Hopefully options right here. Not you. I don't know. It's like the system. So the medication factor and for it, giving me give her minister, meaning, well, the amount of the medication is the same also. The route used, how the medication was given, it was orally, it was intradermal, subcutaneously, whatever the case, intravenous. Most of these are medications that are given subcutaneously or intramuscular because these are vaccines. So that's basically what it is. The patient reactions, remember, patient reactions means how the patient reacts to the medication. Then we are to initially, whoever gave the medication or prepared the medication needs to enter this. Whoever prepared it is the one that is supposed to be giving it or administering. Do you guys see the interruption?
I can't see anything.
Can you guys hear me? Can you guys see the PowerPoint presentation? Because for more
No, I cannot see anything.
Screen
Hello?
and it says that, something is going wrong and it says you're on hold. Hopefully I don't get more interruptions because this is really annoying. All right, let me see. Okay. Okay, so we're gonna continue with this. Okay. So here it is, one of these immunization records. So this is how these vaccines schedules looks like. Probably you have one of those card right there with all the vaccines that were given to me. And of course, what vaccine was that? What was the dose and what day was given? And see, I told you that something was going on. It was kind of kicking me off the system. Now it did it. So I don't know what's going on. To be honest with you, I have two lines of internet and I've been switching line just in case, but it wasn't that. Something else. I don't know what it is. Anyways, so let's continue. So can you guys hear me?
Yes.
Thank you. Okay, so let's continue with this before I get approached with this again. Let me and place the PowerPoint presentation right here. So this is the immunization card. Usually, these immunization cards are given, are kept in records, and sometimes the family member also has one because I do have mine. Yes, I do have mine with all this information and all the vaccines that I have from day one. So that's basically what it is. It's going to be, here is written the name of the immunization of the vaccine, the day that it was given, and remember the signature or the initials of the person that gave you the medication. So that's basically what it is. And on top right here is going to be the name of the patient and any other identification. So that's basically it. So full name and date of birth. So here are a bunch of medications, hepatitis B, remember the MMR, the polio vaccine, and so on and so forth. So all the medications that are required for the child from the moment that, the child's birth, the child has brought to this world. So that's basically what it is. Just for you to know, keep your vaccination records because sometimes your job might require you to have vaccinations. And if you don't have it at that moment, then you have to go and get tested for hepatitis B before you get the job. So basically, that's what it is. If you have your vaccination records, keep it in handy. So if they ask you in your workplace because you have to have hepatitis B, virus, remember, when you start working. And if you don't, then, they delay the process of hiring you, or they might not hire you, or you have to wait until the hospital, orders to you that it start you with the medication because there are 3 shots of hepatitis B that you have to get, one today, the other one 1 month later, or 2 months later, the other one 3 months after the first one. So it is a process. So you don't want to miss out on these vaccinations. So here is one example how you actually are going to document that immunization. That's how it's written. Now it can be electronically or it can be written by hand. That is no longer the case. Now everything is done electronically. So if you see here, remember, we mentioned this already, the date. This is the date that the medication was done, the time the medication was done. What medication was given? MMR, measles, mumps, and rubella. The lot number, see, the expiration date, the volume or the amount of medication that was given. Here it is. What was the route subcutaneously? Where? The right deltoid. So the upper arm on the right side. So that's basically what. So we have to document all this. So we need to go back and see if there was any side effects to the medication on the side, on the arm, whatever. So that's basically what it is. See, it said right here, no localized swelling or redness observed. So after you give the medication, remember, usually, hey, the skin is very sensitive. You can have certain reactions to it, and that is normal. To get that little swelling over the site of the injection or the medication or the vaccine, whatever the case may be, some redness, some pain, of course, that's going to happen. No breathing difficulty is noticed. So remember, if the patient presents with something, you have to document it. But there are some other regulations that you have to document that you didn't notice anything. Why? Because the patient can say later on, oh, I developed something when I was there. And I was like, it's written right here. So that's basically what it is. Now, once again, if anything else needs to be done, that is. Now, some information was given to the family, instruct them what to do if something changes, like for instance, the patient developed fever, but the fever has to be above 103 degrees, because remember, immunizations most of the time are given to little kids, to children. So that's basically what it is. We always have to explain, remember the patients, what to do, what to expect when you give the medication. And remember, we're going to keep the patient or the child there 10 to 15 minutes after the vaccines are being given to see if there is any allergic reaction to it or any bad side effects. So that's basically what it is. Here is signs, see? H, whatever, RMA, Registered Medical System. That's what it means. You will be CMA, Certified Medical Assistant. Certified Registered Medical Assistant is the same thing. It's just that these people took the exam from another organization that offers registration. You take it from another organization that offers certifications. So that's basically what it is. This is like medical doctor that graduates from this university, this one from this university, and took the test in this place, the other took in the place. You're a medical doctor anyway, so there's no issues about which organization gave you the test, particularly for medical assistant for certificates. Now, once again, you don't have to do this because if you don't give medications, you don't have to document. Remember, when we talk about charting or chart, information means entering the information, documenting. If you didn't chart it, means it wasn't done. If you didn't document it, you didn't place the entry, that means it wasn't done. So that's basically what it is. So don't kind of stress yourself about this. It's just part of, you know, the program that needs to cover all this, but most of the information, due to the fact that you are not required to give medications, then, you should not know everything. But yes, remember, you need to know that for medications, we're going to check expiration date, lot number. Remember, it has to be there because we need to know what manufacturer company. With the lot number, we know which manufacturer company manufactured this medication, just in case. So that's basically what it is. We have the name, the lot number, so I know what we covered if we need further information about the medication that causes some issues to our patients. So that's basically what is in. These are immunizations or vaccination schedules. This, you don't have it as a parent. This is not for you. This is for the medical providers. So the medical providers have a list of immunization that has to be given to the patients according to their age. At certain ages, from the moment of birth, we start giving you vaccines up to the age maybe 12, maybe 14, depending of the vaccine. So that's basically what it is. You don't need to know what vaccinations, what is the schedule, when this child of this particular age is going to get this medication. You need to get familiar with your child. It's a different issue, but your medical doctor is going to tell you your child is due to this vaccine. So bring them when they reach this age. But because you are taking your children frequently to the medical doctors because they have to be evaluated for many things because they are in the process of growing, they're going to be reminding you all the time where the vaccine is going to be due. So that's basically what it is. But this will not be asked in any of the exams. Now, remember that this immunization schedule, it is set up based on the age of the patients. So from 1 to 2, from 3 to 5, from 5 to 7, and so on and so forth. So they have these different schedules. Sometimes you have to give medications to children up to the age of 18. Remember, that's minor. It is a child still. So we have to do all these all the time. So no worries about schedule of medication because that's not something that you're going to be doing. So possible immunization reactions. Well, there are many reactions to medications. So since you are not the one who's giving the medication, well, you shouldn't be concerned about it. But if you are the parent or you are the one who's receiving the medication, remember, most of the time, the problems are the site where we apply or administer the medication. Redness, swelling, pain, sometimes kind of discoloration, a little bruise right there. So, or hematoma, do not panic. Sometimes those are reactions that can happen after giving the medication. Sometimes the child develops fever. For that reason, the medical doctor prescribes a antipyretic, some medications to deal with fever, like Tylenol, that is very commonly used, or Motrin. So it is acetaminophen or ibuprofen if it is generic. But most of the time, they gave you this. So they said, okay, this medication, this vaccine might cause you a little fever, a little pain. And remember, this medication that you use for pain, sometimes they also use it for fever, for swelling, because they are anti-inflammatory, antipyretic medications, analgesic medication. So that's basically what it is. Not much like a serious thing. Sometimes you might develop an allergic reaction to the medication, but it's very, very seldom that this happens. So think about it. It doesn't happen often. So that narrative of, telling people that these vaccines actually are not good for your child, Well, just disregard that. Don't believe that. Vaccines can save the life of your child. So just get your child with the vaccines. If it unfortunately something happens, your child's not gonna die with the vaccine. It's just gonna have a bad reaction. That is it. Nothing else. Moving on, so more likely what happens is this is like when you get, the COVID vaccine. You might develop some tenderness on that particular side when you got the immunization. You might get a little swelling, a little pain. You might not be able to move the arm freely. You might develop a little fever, something else. These are things happens. So, but that's not something that is going to kill you. That's not something that's going to be a reason for you to stop the medication. That does not, or to, not continue giving the immunizations. So that's basically how it works. Vaccinations are actually very, very safe. Believe me. So that is it. Don't believe anything else that people says, because that is trying to deter you from getting the vaccine. So that's basically what it is. So administering the immunizations, just in case, one of the things that some of the doctors will allow you to do is immunization, vaccines. So it's not that, you need to be working with a pediatrician. They're going to train you for sure. It's not that, you're going to be asked to go there and give a vaccine. No, someone else is going to train you. And when they feel that you're comfortable enough, if that is what you want, because giving vaccines is very safe. Remember, vaccines are allowed to be administered by medical assistants. Why? Because vaccines are pretty safe. Any other medications you will not be allowed to administer. So you're not going to be giving other medication except for vaccines if the policies of your organization permits that. Other than that, you don't have to do it. So whenever you're going to give immunizations, the first thing that we're going to do is, well, we're going to identify the patient, right? And we are going to determine what type of medication is going to be given. So knowing the medication, now we know in the volume of the amount of medication given and the route of medication, now we can select the site, because that is important. The site to give the vaccines usually depends on what medication is it, how fast it's going to dissolve there, and once again, the amount of the medication, because you can't just give medications in every single route. You can't just put medications all the time over the upper arm, which is the deltoid muscle, or the gluteal muscle, which is part of, the buttocks muscle. Some of them are very suitable to give injections, or for the little babies, which is the lateral side of the thigh. So that's basically what it is. So we need to understand this. If it is an adult, we know deltoid or the gluteus part. But if it is a baby, a little, child, which is a newborn or an infant, well, they have other routes. It has to be the thigh. You're not going to give it to the deltoid because the arm muscle is undeveloped. It's very small. In the gluteal area, you have too many blood vessels and nerves. So we don't want to go there. So for the little kids, we always give the right here on the thigh. Like the upper. So if you have children and you took them to the medical doctor, That's what they do. If these are very little kids, we do the thigh. So that's how it's done. Now you have a child that is a little larger, body mass, remember, it's very important of the child. Then we might use the deltoid. And as the person started developing and growing, now we can go other sides. But it's very common to give it in the deltoid, the gluteal area, and the thigh. Remember, the thigh is the most common site for newborns and infants. So that's when we give them the vaccines, because that's a place where you have enough muscle, less blood vessels, less nerves, versus giving the deltoid that probably is not developed enough for the medication to be reabsorbed completely. So that's basically what it is. So it's very important that we understand this. If multiple injections the same day, if multiple injection needs to be given to the patient to the same day, different sites must be used. Now, all depends. Some of the medications, some of the vaccines are combined. See, we have the MMR. We don't give you the muscles, the measles, the mumps, and the rubella separate. We just give you in ones. But these are medications that do not have any interactions. So for that reason, we can combine few or several medications together. But if they are totally different, they can interfere one medication with the other, then we administer them separately. So that's basically how it is. So again, remember, you can have the first dose, but now we're gonna get a booster. Booster is a dose that is given later on to kind of increase the potency of the medication so it can last longer. So that's basically what it is. Do you remember the COVID? The COVID was, the first, the second, and the third dose. Why? Because once only probably is not going to do much the work. So they want to reinforce the first dose by giving you the second one. And then even further, they're going to give you the third one. And now they're giving so forth. So booster medications are given to reinforce the first dosage that we were giving, because the condition sometimes it is, very prevalent, it's very strong, even though with one dose might not you be covered. So then we're going to cover you completely. There are some vaccines that are given more than once for that reason. Remember, it's to increase the safety. So the immunity that you're going to get with these vaccines, remember, vaccines are called prophylactics. They are done with the purpose of preventing you from getting a condition later on. Or if you develop the condition symptoms are going to be very mild. So the condition itself with the vaccine is not going to kill you. Versus if you don't have the vaccines and you happen to develop the condition, you might die from it. So that's basically what it is. So these are prophylactic measurements that we do to treat the children, to avoid them having all these childhood conditions, because there are many, and that can change the life of the child if it's not given, versus giving the medication to the child to protect them. Remember, it's not that the vaccines is going to prevent 100% you getting the condition, but if you have it, if you develop the condition, if you are exposed to it, then you're not going to have serious effects. you're going to be protected. So you're going to have some mild symptoms. You don't have to end up in the emergency. You don't have to be intubated. So that's basically what it is. So it protects you. Any questions about immunization administration? Now, if your medical doctor, that you work for, wants to train you or ask you if you want to give vaccinations, be honest, say that you are not experienced with that. But if you are willing, if you really wanted to learn how to give vaccines, then you can do it. Other than that, that's not an issue. It's not that you're gonna get fired because you don't want to do it. As a medical assistant, under the authorization of the medical doctor, you can do it. Not anything else, remember, it's for vaccines only. Any other medications, even though if the medical doctor asks you, you should refuse all the time. So that's basically how it works. Okay, liquid forms or medications. Well, medications can be liquid, can be powder, can be solid, can be inhalers or, vapors. They can be in any shape. So that's basically what it is. Or aerosols. So it says right here, solutions, suspensions, emulsions, lotions, liniments, elixirs, syrups, aerosols, tinctures. So medication comes in a lot of forms, but these are the liquid form of medications. Some of them probably you never heard of it. I have not used all of these because there I have some of them in particular that I have used. But there are different forms of medications in. So that's basically what it is. Solid forms, tablets, very commonly used, capsules, also gel caps, powders, lozenges, patches, suppositories, ointments, or creams. Most of these solids are more like frequently used. For the liquids, very few of the ones in the list that we just. Or sometimes we taking the medication or using this medication over the skin, but we didn't know how it was called. So that's basically what it is. See, here we have solid medications. We have tablets, we have capsules. So that's basically what it is. Very simple. Types of tablets, buccal tablets. Now think about this because the next one, you need to know it for exam. It's just that if you have to reinforce information to your patients after the medical doctor has prescribed a medication, it is a good thing to know. So you can tell the patient, remember, this medication, you cannot chew it, you cannot swallow it, you need to place it right on in between your cheeks. That's basically what it is. So that is a buccal tablet. Buccal means mouth, but it is mostly the cheeks. And if you see, it's not inside the mouth, but I'm sorry, it's not in between the teeth and the tongue that is placed. No, this is on the buccal by the cheeks right here. So that's basically what it is. So if you place it in between the cheeks, it's called buccal. Some medications needs to be kept right there. And that's how this medication is going to be absorbed. And that's how this medication is going to work. If you use any other route, it's not going to work. So be careful with all this. This one, Very important. There are two questions for in your national exam based on this type of method of giving medication to the patient. So pay attention to the first one. This is a sublingual tablet. So they're gonna ask you, what is sublingual? Remember, sub means under, lingual means tongue. So it's under the tongue, not on the cheeks, remember? So sublingual, regardless if it is a sublingual medication, needs to be placed under the tongue. Is going to dissolve there. You don't have to chew it, you don't have to drink anything, just place it underneath the tongue, and that is it. That works that way. That is how this medication is going to be absorbed through this mucous membrane underneath the tongue. So that's basically how it works. The same with the buccal. Now, remember questions for the exam. What is the name or what is the method of use when you place, the medication under the tongue called sublingual? What is sublingual? When you place something under the tongue. So that's basically what it is. So remember that can be used either or, just like conversions of pounds to kilograms and kilograms to pounds. They can ask you what is sublingual tablet, or they can ask you, okay, a medication that is placed under the tongue is called what? You look for sublingual. Or what is sublingual tablets? Medications that are placed under the tongue. So that's basically what it is. Very simple. Second question. What is the most common medication that is used sublingually, that is placed underneath the tongue or used sublingually? Nitroglycerin. It is here. I add the little box in the bottle so you can check it out. Here it is. Nitroglycerin. Nitroglycerin. Nitroglycerin is a very, very common medication that helps with patients that are having chest pain. Patients who have cardiovascular conditions. It's not that you're anxious, that you are kind of stressed out and your chest gets tight. Oh, I'm going to put nitroglycerin. That's not how it works. This medication has to be prescribed after patient is being diagnosed with heart attack or some cardiovascular conditions. So anytime that they have problems kind of passing oxygen through the coronary arteries, your chest, your heart is to become very tight and develop some type of squeezing pain. And you develop shortness of breath. Oh, that's the time. But it's not because you're having a panic attack, because that with a panic attack also happened that. So this medication, you don't get it over the counter. Has to be medication that is being prescribed to you. And you're only going to be placing this tablet underneath your tongue if you're having chest tightness, chest pain, and kind of shortness of breath due to the condition. So that's the two questions that you are going to get on your exam. What is sublingual tablets? Oh, what is the medication that is being given sublingually? Remember, they're going to give you a little scenario. They're going to tell you, oh, you're a medical assistant and you have a patient and the medical doctors have other medication that has to be taken sublingually. What exactly means sublingual? Oh, you look for the answer underneath the tongue. Which of the following medications are taken sublingually? They're not going to ask you what is the medication for. Oh, the patient is having the symptoms, one medication. No, they're not going to ask you that. This is very basic. What is the most common medication that is placed underneath the tongue or is taken sublingually. All is, remember, nitroglycerin. That is 100%. This is the most common medication. So that's basically what it is. So don't mix up sublingual and buccal because it will be a huge error. Any questions about sublingual tablets and nitroglycerin? Remember, I want you to pass that test. So for that reason, I'm giving you these answers in advance. Okay. Moving on, no questions. Enteric coated tablets. This is another question for exam. Oh, there were more than I was thinking. Enteric coated tablets. Now, there are certain tablets that in order for you to, oh, well, let's put it a different way. In order for these medications that it's not going to cause any damage to the digestive system because they are very acidic, they are covered by a coat on top. So they look kind of shiny. So what these enteric coated tablets do, what these tablets have as a difference of others, it has a cover on the outside. They place a coated layer. So when it passes through the stomach, this medication through these many acids in the stomach is not going to be destroyed. Because if the medication is a regular medication and it's not coated, the acids in the stomach can damage the medication potency. So you're not going to receive anything. It's going to be destroyed right there within the stomach. So that's basically what it is. So these tablets should not be chewed, should not be broken. Kind of, oh, I'm going to cut it in half. I'm going to kind of, crush it. No. That's the purpose that is coated because it's going to prevent, damage during the passage through the stomach by all these stomach acids. Now, that is one of the questions. What is the most common enteric coated medications or tablets given to the patient? Aspirin. Remember, aspirin is one of the most common enteric coated tablets because aspirin is a very common medication taken for many reasons. Aspirin is an antipyretic, meaning relieves fever. It is an anti-inflammatory, relieves swelling. It is a antipyretic, releases fever. It is an analgesic, relieves pain. So all those things all together. Not to mention that this medication is also an anticoagulant. It is given for patients who has problems with the blood getting too thick. So that's basically what it is. So it has lots of actions in the body. So for that reason, these medications are very common. Remember, there are aspirins that are enteric coated. You should not shoot them. But there are others that are not. If you're having a chest pain and you don't have nitroglycerin, now you can use one of those aspirin tablets and you chew it and you swallow it. That's basically what it is. So difference in type of the medication. Remember, you're not going to be mixing up the regular tablets of aspirin with the enteric coated tablets. Those are totally different. And once again, any medication, any tablet that it is coated or it is enteric coated, is going to be very shiny on the outside. So that means it's very hard to chew on it. They are very hard to cut because they are not intended for that purpose. The other ones, you see, they have different colors. They can be white, but very shiny. If it is not shiny and it is regular aspirin, it doesn't say on the bottle label that is enteric coated, then that medication, you can just swallow it with water, or if the patient is having a chest pain, you can chew it and swallow it. So that's the only time. So think about this, the enteric coated are medication that you cannot chew, you cannot cut, you cannot break, you cannot crush at all. It has to be kept exactly like that. And what is the most common enteric coated tablet? Aspirin. We have many, but these are the ones that they ask. So that's basically how it is. For that reason, I gave you this, the little bottle with the medication so you can see it. Any questions before we move on with nitroglycerin, sublingual, or enteric coated aspirin? So that's basically important things in this chapter that you need to know. Here are other type of tablets, as layer tablets. So layer tablets are, when you have different ingredients in layers. So you kind of see one tablet stick to the next, one on top of the other. You can have one layer, two layers, three layers. That's basically what it is. So no worries about this. There will be now be questions for exam. It's just for you to know the types of tablet. There are many, tablets. Now, score tablets. Pay attention to this and look at the shape of these tablets. Scored tablets. Now, what does it means to have one of these tablets? If they have this indentation across the middle of the tablet, you can divide these. These are the medications that can be cut, break. That is basically what it is. So if you don't see this in a tablet, you shouldn't be cutting it in half. Oh, this tablet is too big, so I'm gonna cut it off. I'm gonna crunch it. Well, sorry to tell you, but that medication is not gonna work for you. It's not gonna do anything. Probably it's gonna cause some toxic effects because you already damaged the medication. So if you see right here, you can see that this tablet, you can cut it in two. One and two. This also, you can cut it in two. One and two. This, you can cut it in four pieces. One, two, three, and four. Can you cut it in half? Yes. But if you have problems swallowing all these tablets, then you can cut it in four. You can cut it in two. But you cannot cut it in more pieces. As opposed to this can be cut only in two pieces. You cannot cut it in four. The same with this. Because you have, these indentations across the medication that is telling you this medication can be cut. Because I come across patients and people that I know that they said, oh, they gave me this medication, but that tablet was so big, I could have problems swallowing. So I cut it on half or I crunch it. I don't intervene. Don't believe me. I don't tell them anything. I don't say, hey, what do you do? That medication. I'm not going to give a lecture. I said, are you sure that this medication needs to be cut in half? You should check with your medical doctor. It might give you something else, might give you liquids. It might give you another medication. Just check it out. But I don't give them a lecture. But I don't stay quiet either. Why? Because the medication is not going to do what it was intended to do. So that's basically what it is. Be careful. If the medication is given for an adult, your child should not get any of this medication. Oh, because I can divide it in four. My little kid needs medication for this. I'm going to give a little piece. Well, you might kill your child. So, not a good idea. These medications were prescribed to you as an adult. If I cut these tablets in 100 pieces, the amount of the medication, the dose of the medication is not going to change. So can you imagine giving this little kid 200 milligrams, 500 milligrams, even though if you're not giving the whole tablet, a little piece that you gave them has the same potency, the same level of toxicity. Remember, little kids, we measure the medications differently based on age, gender, and weight. For adults, not so much because you are already developed. So we can give you a dose that if it doesn't work for you, or if you cut it, if you crush it, probably it's not going to cost you much. It's not going to fix the problem, but your children will intoxicate them. You will poison them, in other words. So be careful. So these core tablets, just in case you have in your exam, these are the ones that you are supposed to be breaking, supposed to be cutting in half or more. Any other tablets that do not have this, you should not be cutting them off because the medication is not going to work. Any questions about these tablets? And I focus mostly on the things that you might have in your exam. And I give you, once again, images so you can have a better idea of what I'm talking about. Because if I just start doing drawings and things like that, probably you're not going to get it. But if you see it like this, when you go home, if you have medications or your family is taking medication, check the tablets to see if they can be cut or if they are coated, because they are very shiny, remember, and very hard to be broken. So again, don't take no chances. Classifying characteristics of a drug. Well, medication, remember, can come in different shapes, liquids, solids. It can be a patch, it can be a cream, it can be an ointment. It can be in a form of, aerosol that you can kind of breathe in. But also we're going to have medication depends of its effect, where they work. We have a local or systemic effect. So local, remember, it is for that particular area, and it works only in that area, like placing a cream right there on top of a rash or a little cut. So we're just gonna go locally. Remember, that was like anesthesia. If I'm gonna apply anesthesia just to work on this particular part of the hand, the finger, the arm, the leg, I'm just gonna apply anesthesia right there because I'm gonna do some sutures, right? So I don't want you to feel too much pain when I'm, placing the sutures. So that will be local. Systemic means it goes through the blood system. Not every single medication needs to go to the blood system. If you have a rash and I'm giving you a cream and ointment, it's just going to stay in that area because that's when you have the damage. That's where effect is going to be focused on. But if it is systemic, that means goes through whatever route, but then it goes directly. It's going to end up in the blood flow. That is systemic. And something that gets systemically is going to be very dangerous if it was not intended. Can you imagine you give a patient a intramuscular injection and you gave the wrong dose or the wrong medication, or you gave the medication to the wrong patient? How are you going to get it out? How are you going to retrieve the medication? It's already in the muscle. Not going to be able to get it out. What about giving a medication right there on the vein of the patient? It goes directly in the blood flow. If the patient is going to develop a reaction, they're going to develop it in seconds. How are you going to get this medication out? So it is very, very serious. That's why, trained people needs to administer medication like nurses because they spend 85% of the time at school learning about medications, side effects, sites when you're going to place the medication, the routes of the medication, what syringes, what volumes, what needles are they going to be using. So that's basically what it is. It is very complex. We're going to have therapeutic effect. So we have all this information here, see? So we have every single information. Not therapeutic effect means that the medication is going to work for, the problem that you have. If you have pain, I'm giving you this pain medication, analgesics. That's the category, the classification. But remember, therapeutic means therapy. Therapy means treatment. So I'm giving you something to treat this particular problem. So that's therapeutic. So also, how this medication works. Through which channels these medications are going to go to the target area where the problem is at. What systems these medications affects, because that's the classification. Remember that medications that are given for the nervous system, for the muscles, for the joints, and so on and so forth. So medications are given for a lot of things to increase your immune system. So we need to be familiar with that if this is the profession that we have to administer medications. The chemical structure. You don't have to learn the chemical structure. Only pharmacists and the pharmaceutical company. Medical doctors have no idea the chemical structure of formula of medications. I do not care. I care about the brand, the trade name, or the generic name. What is the medication? What is the side effects? What is the indications? What is the contraindications? Who should get this medication? For which condition? That's our concern. The chemical structure has to be done, but this is part of the classification of the characteristics of a drug. Not that you need to know it. Now you need to know just is the basics, local or systemic. Now how the medication works in the body, you don't have to explain that. But yes, because they're gonna say, okay, the patient has a rash on their arm and you're gonna give them an ointment. How this medication is gonna work? Locally. Medication has to be given intramuscular, intravenous. How this medication is gonna work? What is the effect of this medication? Oh, that's gonna be systemic. Remember, creams, ointments, and things like that, they are just on the surface. They're gonna act on that particular part of the body. So just common, and basic knowledge for you. If you apply a little cream because you have a little pimple, something like that, that cream is not gonna go to the system. Or you have a mouth sore and you apply a little something, that is not gonna go to the system. It's just gonna act locally. Oh, you have a pain. Oh, well, that's gonna go to the system. You have a headache, that's gonna go to the system. But what part of the system is affected? The nervous system. If you have muscle pain, well, it's gonna go to the muscle then. And so on and so forth. If it is medications for your blood vessels, oh, it's a vascular medication. If it is for your heart, oh, that's a cardiac medication. If it is for your brain, oh, that is medications for the nervous system. So that is basically how all the medications are classified. They are classified depends of how the medication is given, what is the route, where it has to go. It's going to stay or where the problem is at in the surface, or it's going to go inside, because pain, if I have pain in general, how do I know where the pain comes from? If it's headache, how can I apply a cream on my forehead? It doesn't work the way. I have to take medication that is going to go directly and affect the nervous system so it can release that. I have a muscle pain. I have a knee pain. Oh, I just put a cream right there. Well, yeah, there are some creams for that, but that is if you have trauma. You just fell down or something happened to you, something hits you. Well, that is localized. You take something for that area. But if it's something in general, oh, I have abdominal pain. Oh, I'm going to rub something over my belly. No, it doesn't work that way. You have to take something that is systemic. So that's how it works. So medication terminology, this is very important for you. Now, it's not that you're going to have all these questions in your exam, but there are some of the questions that, are going to be leading towards some of these particular terms, and you need to be familiar, particularly when the patient comes back and he says, hey, the medication that the doctor gave me, or they call you over the phone, say that medication that the doctor gave me an allergic reaction. Now you don't even know what is an allergic reaction. You don't know what is the side effects. You think that side effects and allergic reactions are the same, which are not. They are not. They are totally different. So what is the side effect? Unwanted but expected drug effect. See, that is totally different. Side effect is something that the medication produces to your body. It's a reaction. It's an adverse reaction. Unwanted reaction to the medication. But it's not an allergic reaction. So that's basically what it is. So if you have nausea, vomiting, diarrhea, abdominal pain, headache, that is a side effect of the medication. Make you dizzy, that's a side effect. So side effects and adverse reaction is the same. It's just that here they place it like separate, individual. But those are the same. Think about it. Side effects, adverse reactions, those means the same. So don't, these terms can be used interchangeably. That's basically what it is. Toxic effects. Now, this is a different issue. This is not a side effect or an adverse reaction. Toxic effect is because you got something, you got a bad reaction due to too much of the medication in the body. So whether you gave or the medication is not being processed, utilized inside your body. So it accumulates. So remember that I told you that every single time that a patient starts with certain medications, we monitor the patient. We want our patient to come back certain time after medications were prescribed to run a blood test to see the levels of the medication inside the blood, to see if there is any levels of toxicity or not. Because if we don't do it, that is malpractice, because the patient can develop a level of toxicity. It can affect any of the organs, particularly the kidneys and the liver, which are the major organs that kind of processes this medication. The medication has to pass through these organs, metabolized by these organs. It can damage these organs. That is a serious condition that can lead to death. You can die. So that is toxic effects. So it's not good. Once again, that's what you hear sometimes. Oh, it got intoxicated. Well, we're talking about medications, but you can get intoxicated with alcohol. Now, you can get intoxicated with any chemical. You can drink something that you weren't supposed to be drinking. So intoxication, poisoning, it is very similar. It's just that poison is something that you shouldn't be taking sometimes. Medication is something that you should be taking. It's just that you have too much, or was giving too much, or your body is not metabolizing this medication and accumulates in the blood or in an organ. So that is the difference between all these. Now, poison is something, you don't say, oh, they got poison. Poison is because it is a chemical that is used without the intention. This is a medication. So generally, we said overdose or intoxicated. Because remember, people can drink alcohol. You don't get intoxicated because you drink moderately. So you're not drinking too much. But if you drink in excess, your body can be intoxicated. You actually can die due to the intoxication. It's not poison because it's something that is used to drink. It's just that in large quantities, it can cause toxicity, just like medications. That's basically how this works. Any questions about side effects, adverse reactions, and toxic effects? So remember, side effects and adverse reactions, these are the same thing. Whenever you've been asked, do you have any side effects? Because it's kind of a lot easier to say side effects than to say adverse reactions to the medication. Because adverse means, it didn't do the intended, action that it was supposed to. The side effects is something that might be doing the intended, but still it's going to cause something that you don't want. So now unwanted reactions or effects to the drug. But we can use these terms interchangeably. Any questions before we go on break? Okay, so we're gonna go on break. We come back 7:40, and we're gonna continue with this chapter that is almost over, and we can start another one. All right, so see you later. Enjoy your break. 7:40. Just return 7:40. Okay. See you guys later.
Okay.
Thank you. So I hope you guys enjoy your break. So we are back. Okay, so let's continue with this chapter. It's almost over. Once again, I hope you guys enjoy your break. Okay, everything is fine. Okay, so any questions before we start? Before we continue? Okay, so let's continue with this types of tablets. We went over this. Let's see, classification, medical terminology. Okay, so we continue with the medical terminology. Remember, we were talking about when we use medications, we talk about side effects, adverse reaction, and the toxicity levels. Now we're going to talk about contraindications. This is very important, not because you will be asked on the exam, but for you, for your patients. Remember, sometimes, hello, sometimes we use medications that had not been prescribed. That medications can be a contraindication for whatever we're taking. So we have to be very careful. Home remedies, over-the-counter medications. So what is a contraindication? A contraindication is a drug that should not be taken for any situation, whether it's going to affect other drugs that you're taking or a medical condition that you have. So that's basically what it is. So we need to be on the lookout of all these information that comes in the medication whenever we're taking medications, particularly for your patients, and make them aware that they have to read the insert of the medication where they can read what side effects you can get, what are the levels of toxicity, what are the contraindications of the medication, because sometimes, once again, we might be taking something that is not prescribed that can interfere with the effects of medications. Remember, medications, there are certain medications that you cannot take if you have certain medical conditions, because that can be against the condition. So it's going to make things worse, or against other medications that you're taking. So that's basically what it is. Think about this. Pregnant females are, kind of, they cannot take certain medications because you're pregnant, and that can affect your fetus because these medications are absorbed by the placenta, and then you can damage the new life that is growing there. So that's basically what it is. So we have to make sure that we understand this. Now, risks outweighs the benefits. Now, once again, when the medications that are prescribed to you or are about to be administered to you, the benefits are greater than the risks, then we give you the medication or we do the procedure, in this case, the medication. But if the risks are worse than the benefits, we refrain from giving it to you. You're not supposed to give medications that are going to be affecting you more than their benefits that they're going to be provided. So that's basically what it is. So I have an example right here. It can be anything else. So sample varicella vaccine not given to pregnant women. Why? Because this vaccine is going to go to the fetus and it's going to damage the fetus. So that's basically what it is. And not only that, certain medications you cannot take. So when you're pregnant, definitely you're going to be monitored continuously because there are many contraindications for pregnant females to take certain medication. Just an example, but once again, there are certain conditions that you may have or your patient may have that you have to be very careful when you prescribe medications because you can make things worse instead of getting things, fixing things or relieving things. Warning levels. So right here they are. So we have to be very cautious when we use medications or any drugs, any chemicals for that matter, because they have warnings right there that we have to read all the time. So remember the medications that we have, regardless of whether they are good for you, for the person intended to be administered, has labels, have warnings. It says, keep these medications, away from the reach of children. Why? Because if a child eats your medication that is not intended for them, that can kill them. So that's basically what it is. Every single chemical has a warning on the label. If you are pregnant, please do not smoke, do not use this, do not do that. Those are warnings. If you have this condition, please do not take this medication. So they tell you all that. So that's basically how it works. And we have to follow these warnings because it's been proven. This is not someone who just randomly select these warnings and put it on the bottles. No, this has been proven through trials, research, and for precedent, people who have already have these problems and then they have to be added to it. So people know that there are some problems that might arise when you take certain medications. And if you don't have this warning and you develop any side effects or a bad reaction of something that is going to cause you to become sicker, then we are going to sue the person that prescribed this medication and the pharmaceutical company that did not put a label in those medications. So again, or chemicals for that matter. So that's basically what it is. You can read it on your own time. So remember, you should not be drinking and taking medications at the same time. Those are warning labels. So that is going to be a contraindication. So you just need to be familiar with things by reading the insert of the medication. So the patient needs to be instructed that whatever medication they take in, they should read the insert to get familiar with the medication, side effects, contraindications. And what is the reason, more importantly, what is the reason that they take in the medication? So that's basically how it works. Okay. Prescription information. So now we're talking about the information that is going to be written or is going to be contained within a prescription pad. Patient demographics, physician's demographics. Remember, patient's demographics means patient's name, patient last name, day of birth, male, female. So that's basically what it is. So we are talking about the personal information, identifiable information. The physician's demographics, it has to be there the name of the medical provider who is prescribing this medication, as well as not the day of birth, but the licensing. What license they have, license number, MPI number, the DEA number, depends on what medications they are prescribing. So you can't just, use a prescription pad and, start writing medications to someone if you're not authorized to do so. because when the pharmacy receives this prescription, it has to be the signature of the medical doctor and the license of the medical doctor. Other than that, the pharmacy is not gonna fill that prescription. That's basically what it is. Subscription, incretion, subscription. Now, these are different, kind of, well, let me see, find a word that is a lot easier for you to understand. All these watermarks or all these details that a prescription has to have in order to be legit. That's basically what it is. Now, fortunately, this is no longer the case because these prescription pads are no longer used or are not widely used like used to, because now we have the e-prescription. Because this e-prescription goes directly to the pharmacy from the medical doctor's office or from the hospital. So the other prescription pads were done in a way that, you give it to the patient, but you don't know where this prescription pad is going to end up. Because sometimes the patients do not take the medication. Somebody else might have the prescription. Some people sell the prescriptions. So a lot of things going on. For that reason, they came out with the e-prescription. Signature. Of course, you have to have the signature of the medical doctor who is authorized to prescribe that medication. So that's basically what it is. It's going to have a refill line or box. Remember, any refills, then you have to check the box. And it has to be written also how many refills you want. Why? Because there are some medications that do not need refill. So in others, the medical doctor has to evaluate them first, monitor them first, do blood tests, and it depends on the levels of accumulation of the medication. Then you can continue with the medication or you can discontinue the medication. Some other medications are given for a period of time because that's the period of time that takes the medication to do their work, and that's it. If you have a bacterial infection, viral infection, you have a fungal infection, this medication is not supposed to be taken on a regular basis. So that's basically how it works. Once again, here it is, the DEA number. This is the Drug Enforcement Administration number. These are the numbers we're going to see later on in another chapter, because every single medical doctor that prescribes controlled substances, not any regular medication. Medical doctors, when they graduate, they can prescribe certain medications for certain conditions. But there are certain levels for certain control medications that they cannot prescribe. Just the fact that you are a doctor does not imply that you can prescribe any medication. That is not the case. If it is controlled substances are those substances that usually make you addicted to it. So we don't want medications that make you addicted, but if you have to take medications that make you addicted, now the medical doctor that prescribes this medication has to have an extra license. It's not the license as a doctor. This is a license that you can prescribe these medications. And that particular medical doctor is going to be monitored by the Department of Justice. So that is the DOG. Remember, Department of the General Administration. So that's basically what it is. So we're going to talk about later on about the DEA number, because you will be asked on exam. That's basically what it is. But I already gave you an advance. So the Drug Enforcement Administration number is a license that a medical doctor needs to get if they're going to prescribe controlled substances. But we will see that later on. Just for now, we're going to leave it here. Medication record. Now, again, when we evaluate question interview our patients, because remember, we interview our patients when they come to visit with us. They have a medical condition, we need to know what is the reason. But then we're going to go over all the things that might be useful for us to diagnose the patient. So prescription or over the counter, remember, there are medications that are prescribed by a medical professional, other medications that you do not need a prescription. You can just go to the pharmacy and buy them over the counter. So some of them are covered by insurances, some of them are not. So if it is with a prescription, you can get a prescription pad or a pre-printed form that is given by your doctor. So most of us are familiar with those prescriptions. Why? Because the e-prescription is fairly new. So but that's basically what it is. Always a part of the medical record. These prescription pads, or regardless of how we prescribe the medications, that is going to go to the medical records. Every single time that we prescribe medications, it's going to be on the patient medical records. This is going to be a diagnosis, it's going to be a condition that we diagnose the patient with, and how we're treating the patient. So therefore, this medication needs to be noted, needs to be entered, needs to be recorded, needs to be documented on the patient medical record. So that is basically what it is. Now, remember, these medications, we have to go over every single time the patient comes to the office. So that's basically what it is. So if we give you a medication, we're going to give you a prescription. Whether it is electronic, whether it is the one that is written by hand, it doesn't matter. We need to keep those on the medical record. So we need to, show, document that we prescribe something for the problem that the patient came to see us. So that's basically what it is. If there is a refill, now the patient doesn't have to come to the office. Patient can call us over the phone or through the patient's portal and let us know that they need a medication refill. Remember, medical assistants do not call the pharmacy to refill the medication because the medication was sent or was told to you. No, this request for the medication refill needs to go to the doctor, and the doctor is the only one that can decide whether this patient can continue with the medication or not. Now, you can be directed by the doctor after they receive the order from the patient. The medical doctor reviews the medical record. They can tell you, depends on the medication, once again, they can ask you to call the pharmacy. Hey, call the pharmacy from this patient and tell them to give the refill for this medication. The medical doctor is going to give you all the information. Because the medication that they're going to take is not a controlled substance. If it is a controlled substance, medical assistant cannot call. It has to be done by the medical doctor. No one else can call. So remember, the patient comes into the office to request for a refill of medication. Oh, I need a medication refill because my medications, I don't have medications. It is over. Then remember, the medical doctor needs to see the patient before the refill. The medical doctor needs to be informed about the refill because the medical doctor might need to order a blood test to check for the levels of accumulation of the medication in the system. Or if it's not a big deal, then the medical doctor can, actually give the refill to the patient. But the medical doctor needs to have this information first. Now, remember, you can be designated to or delegated to call the pharmacy only if the medical doctor um, sees this viable. Other than that, medical doctors do the job. So that's basically what it is. Certain information that has to be with the refill. Remember, the refill has to have all the information before you call. The name of the patient, the day of birth, the insurance that is going to pay for the medications, and then what is the name of the medication, what is the dosage of the medication, how often, how frequent this medication has to be taken, and whether they have refills or not. Remember, you do not check the box that says refills if the medical doctor has not checked. If the medical doctor says give one refill, you don't have to pay 2 or 3 because the patient asks you to do it. But sometimes the medical doctors trust you and they might give you the prescription pad already complete and signed, but they forgot to check the little box where it says refills or no refills. So be careful with all that because that can get you into trouble. And that happens when it's a family member of a friend. So be careful. Your family member, your friend, is not worth for you to lose your job or get in a legal situation. So the answer is no. Always. Never do anything that violates the policies of your organization. So please be on the lookout all the time. The medication record, every single patient is going to have a medication record. Of course, we're going to have for each medication all the information about the patient, the condition of the patient, the medication, what medication is being given, what is the dosage, the date that was given, for what reason it was given, and so on and so forth. So we always keep medication records. How are we going to know what medications we're giving to the patient? We don't discard this. So that's basically what it is. Now, you don't have to deal with this because you are not giving medications, but you know that every single time that the medical doctor give you medications, they're going to have a medication report or record. Every single time the medical doctor give you vaccines, they have a record or a vaccination card that they are completing. And they keep it in your medical records just in case it's needed, but mostly because we need to keep all your information documented. So that's basically what it is. Very simple. So I make emphasis on the things that you actually need for the exam, but also the things that you need to understand as a medical assistant, just in case you have to give information to the patient or you need to reinforce information that the medical provider has delegated to you. So that's basically what it is. If we don't know something, when you have to reinforce information, does not imply that you're going to tell the patient side effects, contraindications, adverse effect. No, that is not what I'm implying. Reinforce information is, hi, Mr. and Mrs. Smith, the doctor have ordered this medication. Remember, you're going to be taking this medication every day, every 12 hours, every 6 hours, every other day, before meals, before you go sleep, whatever the case may be. These are very simple instructions. You're not going to get involved in details about anything about the medication. It's just how it's taken because you want the patient to comply. That is basically what it is. Any other information, you should refrain yourself from delivering anything else to the patient. Remember, that can get you in trouble. Okay, any questions about understanding medications on how? Remember, there were like 4, 5 things that you need to remember for the exam. So just keep it in mind. Most of the stuff is highlighted. So that's basically what it is. And probably we're going to find this information again in another, chapters. So just keep it in mind, that's the way we work. We kind of repeat information over and over so you don't miss any of the important information. Okay, so let's move on. We are going to any questions again? Okay, so let me share with you this new chapter or unit. Okay, so this is drugs, drug sources, schedules, and dosages. Now we're going to talk about in this chapter where these medications are made of from, where they're coming from. So that basic, not the place, is from where do we get these medications? Once again, we're not talking about the pharmaceutical company. We're talking about they come from plants, from animals, they are synthetics. So that's basically what it is. The schedules of medication. Remember, we're going to talk about these controlled substances. The dosage, well, how much of the medication the patient should get, kind of thing. So that's basically what we are going to be addressing with this chapter. So let's start. Some terms that, you need to be familiar with. Abuse. When we're talking about abuse, we're talking about abuse of medications. Remember, certain people just abuse the medications. What is abuse of medication? Taking more than you're supposed to. This medication, the medical doctor gave me 200 milligrams. But it's not kind of doing much. If I take double, I think that is going to be better. That is the mentality that we have when we are not familiar with toxicity levels, side effects, and lethal levels and toxicity, for instance. So abuse. People abuses everything. Remember, they abuse alcohol, meaning they take more than they can handle. Medications, remember, medications are abused for many reasons. Medical doctors abuses, or medical personnel in general abuses medications. Like, for instance, morphine, Demerol. They take this because, they are too stressed out in the workplace. There are too long hours work, so I can't handle all this pressure. So let's get something to make me, better or stronger, something like that. Remember, we can abuse even over-the-counter medications, home remedies. I'm going to take this over-the-counter medication just in case I get something, because I don't want to get that. That is abuse. You can't take something when you don't have something. If I don't have a headache, why should I take pain medications, analgesics? No need. So once again, people abuse medications. They just take medications for anything or everything. A little something, no, I need to take something. They got a little scratch, no, I need antibiotics. I need pain medications. That is abuse. Addiction. Well, after abuse, it comes addiction because there are some medications that are very addictive. That's part of the control substance that we're going to talk about. So remember, addiction is when you take the medications over and over and over for other than what is intended for. Because there are some medications that have different effects on the human beings. So some people finds certain medications better for other things. See, Benadryl is used for an antihistaminic. Oh, you have a little allergic reaction to something. Oh, you take it. That's good, but it has to be prescribed. You can get it over the counter. Oh no, you're gonna use it because you are so stressed out. You cannot sleep. You have insomnia. So then you start taking all these medications without being prescribed. That's gonna create a disarray of patterns on your system. Your body now doesn't know how to react to the regular, changes in your body because you are adding something else that is doing the work for. So not good. Well, we know what is administration. Remember, administrating medications. We are going to talk about biologics, which are, medications that are done using biological, tissue. That's basically what it is. That is the same, that goes alongside with biotechnology, which is the science or the study that is going to use the biologics or tissues or fluids, body fluids from the body to get, medications. Controlled substance, we're going to talk about that. Remember, there are 5 schedules of medications, 1 through 5 Roman numbers. So we're going to talk about what controlled medication substances are and which medications are in each one of these particular levels, level 1, 2, 3, 4, 5, which is called schedule 1, 2, 3, 4, and 5. Dispense, we know that the word dispense means to release. So dispense means to give. If the medical doctor prescribe medication, the pharmacy is going to dispense it to you. So they're going to prepare the medication and it's going to give it to you. Narcotics, those are type of medication that affect the nervous system. So that's basically what it is. Pharmacopoeia. This is a directory or a book when we have all the formulas for all the medications, all the names of the medications, brand and generic, side effects, and all the information. It's like directory. That's pharmacopoeia. So again, very important, practitioner. Remember, practitioner is someone who practices, the medical provider. So that's basically what it is. Prescribe, well, we know what prescription are. So you're going to receive what the medical doctor prescribes. So the practitioner prescribes a medication. Now it's going to be sent to the pharmacy and the patient is going to receive these medications from the pharmacy that has been prescribed. Remember, there are many medications that only can be dispensed if are prescribed by the medical doctor. The only medications that are not, that don't need a prescription are over-the-counter medications. Remember, over-the-counter medications are medications that are approved by the FDA, but they show very low risk if you take it. So for that reason, they are over-the-counter. So no need to have a prescription. Any other medication that has more risks for side effects, for adverse reactions, toxicity, then needs addiction needs prescription, or abuse needs a prescription. So that's basically what it is. So subdivisions of pharmacology, we went over this already. Pharmacodynamics, pharmaconoxy, pharmacogenetics, pharmacokinetics, pharmacotherapeutics, and toxicology. These are different departments within, the pharmacology department, the pharmacy, let's put it that way. Because remember, the pharmacist, which is the specialist that, kind of put all these chemicals together, all these compounds together to form a medication that is going to be taken by you, that is going to be dispensed for your use. So you go through all these processes. So they need to know how the medication works in the body, how it reaches certain systems, organs, tissues in the body, and where does this medication come from? What it's made of? So that's basically what it is. And of course, what is the intended action of the medication? And it is toxicology levels. That's why all the medication have a dosage. A dose that needs to be given depends of each individual. Remember, it's going to be based on age, gender, and weight. They are the one who creates, let's put it that way, manufacture these medications after being approved by the pharmaceutical company. Now, the pharmacies have the right to make those medications. Remember that the pharmacy is not like convenience store, that the medications come already pre-made, pre-packed by the pharmaceutical company. It doesn't work that way. They have the formula and they have to put all these compounds together, all these chemicals together, and they make the medications right there at the pharmacy. That's how it works. That's why sometimes you go there to pick up your medication, it says, oh, come back in 5 hours, 2 hours, 3 hours. Oh, we call you. You want us to deliver it to you? Because some of the medications are made of by all these chemicals, because that's what you have a pharmacist over there. It's not the person that is taking care of on the counter. No, that's a technician. The pharmacy sometimes shows up, but the pharmacist usually is on the back preparing all these medications. So that's how it is. So in one of these pharmacies, you're going to have all these departments, all these divisions, because one person do one thing, the other person with another thing, the other. But as a pharmacist, you need to know all these subdivisions, all these processes, because you need to understand how medications are done. And the end result of the medication, pharmacotherapeutics, and toxicology. That's basic. When we talk about toxicology, we are talking about side effects, adverse effects, contraindications, anything that is negative, cumulative dose. All that is negative is part on the little dose. All those are part of the toxicology. Why? Because if you take too much of the medication, or if it is accumulated in the system, your system is not metabolizing this medication, this chemical, then it's going to create some type of toxics inside your body. So that's basically what it is. So here we mentioned this already, because remember, most of the stuff overlaps. Uses of a drug, therapeutic. Remember, therapeutic means that it is going to help you to relieve symptoms. It's not going to cure you. No, because we have the curative medications. Curative medications are for those conditions that are infections, like bacterial infection. We have antibiotics. We give an antibiotic, we give a certain amount of antibiotics. For a period of time, they get rid of the bacterial infection, the viral infection, while we with an antiviral. The fungal infection, the parasites, we give you medication and get rid of them. These are only for infectious diseases. Not all of them, because there are some viral infections that we cannot eradicate, because remember, viral infections, we do not kill the virus. We isolate, we kind of take the virus as a prisoner so they cannot multiply, but the virus continues in your body. Bacterial, we eliminate them. Fungal, we eliminate them completely. parasites, we eliminate them completely. So for that purpose, we have the curative. But the therapeutic is for all these medical conditions. If you have diabetes, high blood pressure, if you have heart conditions, we are giving you medications just to relieve the symptoms. That's therapeutic. So that's basically what it is. Diagnostic, we talk about this. We use certain drugs to diagnose you, certain chemicals, to see what is it that you have, to see, to aid us diagnosing you. Because diagnostic means to try to find the diagnosis, checking your urine, checking your blood with all these chemicals that we use. So that's basically what it is. Replacement, remember? Well, replacement means something that you don't have in your body, you don't have enough calcium, we replace it. Because after certain years, particularly females, they lose calcium. So vitamin D, vitamin B12, vitamin B6, zinc, any minerals, anything, iron deficiency. So we give you as a replacement, remember. So that's basically how it works. So replacement is not that I give you another medication because this didn't work. No, that's not what we're talking about. It is that we're using these drugs to replace the ones that your body is not producing or your body is not using, so you have deficiency. Prophylactic, remember prophylactic, it says right there, prevention. These are medications that are used to prevent something for you to happen later on. That's what we give all these vaccines. So vaccines are prophylactic. So remember what I said. Vaccines are considered prophylactics because if you have a question in your exam, it will be that. Why? Because now it is a trend. Remember, we gave you or you received COVID-19 vaccine. For what? To prevent you from getting the COVID. When you were a child, you get the mumps, measles, and rubella, MMR. You get the polio vaccine, you get the hepatitis B vaccine, you have the tetanus vaccine, the diphtheria vaccine. Why? Because we didn't want you to get these conditions when you were a child because they are very prevalent. Prevalent means that they are very common in children and they kill or they disable the child. So that's basically what it is. So those are prophylactics. Think about this just to make it a lot easier. These medications like those preservatives that we use to avoid getting venereal disease, like condoms, those are prophylactics, remember. Medications for not getting pregnant, those are prophylactics. When you don't want to get something, then the flu vaccine, because we're going to prevent you from getting the flu. Those are prophylactics. Remember, it's not that they actually are going to prevent 100% the condition to happen to you, but if you develop, now you're going to be protected because you already have these antibodies inside your body that are very similar to those ones of the condition. So when the condition arrives, you're not going to be a foreigner. You're not going to be a stranger in my body. You are going to be recognized. That's basically what it is. So that's what I'm giving you this that is very similar to what you might get. So when you get it, it's going to be recognized. And now it's like when you see someone that you know, you feel comfortable. But if you see someone knocking your door and you never seen this person, are you gonna let them in? Definitely not, right? So that is exactly what happens when you get these prophylactic vaccines or medications. They're gonna enter your body, and when the infection enters your body, if that is the case, they're gonna be familiar. You're gonna have someone waiting for you, like you have a bodyguard right there in your body. I recognize you. You are the shoplifter. You are the criminal. Oh, you are this particular bad element. Let's put it that way. So that is what all these prophylactics do. Remember, just to prevent something from happening or to prevent to get really sick. So that's the purpose. So I got the COVID-19, thank God. Nothing happened to me. But some people got the COVID and some people developed some symptoms, but they didn't end up in the emergency. They didn't end up intubated. So I don't want to go over anything else because you heard many things and I don't want to discuss that because, fake news always are going to be there. Drug names, we talked about this already. Remember, some of the chapters just overlaps the information. The chemical name, which is the formula, the chemical formula of the drug that is created by the pharmaceutical company. Then we're gonna have the brand, remember, because the brand name is the first one, not the generic. You do not have generic if you don't have a brand name. Remember, brand or trade, you have to first this one. You create your chemical formula. Now you do all these trials. Remember that I told you this story. You spend millions of dollars for a period of 5 to 10 years. That takes a long time to create a medication. Then after those trials on small animals, large animals goes fine, meaning no many side effects or adverse reactions, then it's going to go and try it in humans. If that goes fine as planned, then the FDA that has been monitoring this from day one, they're going to tell you, okay, go ahead, try it on animals. Go ahead, did well. I have the trials, I have the research, I have all these studies. Do with large animals. Oh, everything is going good. You can do it now in humans. Now remember those humans that are used for the trial of trying these medications, they have to sign a consent that they are volunteering, but has to be someone who has a medical condition for which these medications are targeted to. This is not someone else. This is not me that I don't have medical conditions. You want to try this medication? What am I going to try medication that I don't have a medical condition for? So it has to be someone who has the condition and other medications has not worked for them. Then they sign up and they have to sign a consent because if something happened to them, the pharmaceutical company is not going to be responsible. Why? Because you sign is a voluntary thing. If it works, fine. If it doesn't, well, sorry. So remember, then they're going to create the brand. Then it says the FDA tell you, hey, you have the green light, your medication work for the little animals, for the large animals, for humans. So now let's put it into the market. What is the name that you're going to give to this medication? Oh, we're going to call it Motrin, because yesterday we call it Tylenol. We're going to use another one, Motrin. Okay, so you're going to use Motrin for 15 to 20 years. And after that, you have to give the rights, you have to give the formula to the government. So they said, okay, not a problem, because you have to help, The population. You're already millionaires selling all these medications. So now the government takes over the formula, but you are the one that you manufacture medication, you keep on manufacturing, that is a brand. Now you can manufacture mine as a generic, or I can hire another pharmaceutical company to do because that's the government. But remember, the government didn't pay anything to do this. During those 5-10 years of trials, millions of dollars invested in creating the medication, the government is not doing any of those. The government is just held the prescription, oh, the formula. Hey, here you have. Now, pay someone in that pharmaceutical company just to create those medications for you, to manufacture those. Now I have to give a different name. That is the generic. Remember, generic of official name. So now Motrin is the brand, the trade name. What is the generic name for Motrin? Acetaminophen. Oh, I'm sorry, ibuprofen. So that's it. Now, if you see every single time that you take medication, they have both. Well, they have the chemical, but do not worry about that. Most of the time, we worry about the brand trade or the generic. So it says right there, Motrin, look underneath of Motrin, it says ibuprofen. And the other way around. If it is generic, it's going to be first generic with capital letters. So the brand usually comes with capital letters. The generic, lowercase letters. So that's how it works. So now the government uses these medications for people who has government insurance or for someone who doesn't have enough money to pay for the medications or a medication that is cheaper, whatever the case may be. But generic and brand and trade, they are the same formula, the same content. They just change colors. They might change the shape of the medication and probably, other chemicals to change the color. Remember, that is a different issue, or the size, or the shape. But anything else is the same medication. So that's what we talk about. So here it is. How would you explain the difference between brand name and generic drug? Remember, you don't have to explain that to your patients. What you have to tell the patient is brand and generic are the same medications. Don't tell the story that I told you because that you're never gonna end. So just tell them, no, the generic and the brand is the same medication, the same ingredient, so to speak. It's the same formula. So here we have the drug sources. Any questions about these? Once again, drug names. Remember, drug names are very, very important to understand for your own good. And who knows, hey, how do I know that you're going to move to the next level? You're going to become a nurse. You're going to become a nurse practitioner. You're going to become a PA, physician's assistant, or physician's associate. They changed it already. Or you're going to become a medical doctor. Who knows? I have medical assistants that they took my class long time ago, and some of them are nurses. I have a couple of them that they are doing the PA program. I have one, oh no, he changed his mind. He was going for a doctorate for medical, and then he decided to move back to PA program. So again, you never know where you're gonna end up. At least you have this general knowledge for your information. Just in case the patient is arguing something, remember, don't get into confrontation to the patient. That is not the purpose. It's just for you to clarify something in nice terms. Oh, I'm not taking this medication. This medication is not good. This generic, that is piece of something. No, don't follow along. Just tell them, by the way, tell it like this. By the way, I'm taking the generic, and my doctor explained it to me, that generic and brand name are the same medication, has the same ingredients. And I read the insert because they already tell you what is this compound, what is this medication made of. And if you look Motrin, if you look ibuprofen, the same compounds. So what is the difference? Have the same side effects, the same adverse effects, same dosage. So what is the big deal? So you can do something like that. Every single time that I have someone, I don't confront them, giving them a lecture. They don't want to hear about a lecture. They don't understand anyways. They don't even know what the FDA is or it stands for. They don't know what is brand, generic. They don't have no idea. They just gave me this medication that doesn't work. That's what they say. So you're going to tell them, oh, I take the same medication and my medication works really well. I used to take the older one, even though if it is not true, it's just to relax, to calm down your patients. You know what? I used to take that medication, or my mother, my father, my friend. It makes someone there. That's what I do. I'm making a story just to make the patient feels good because I'm not lying to them. I just want to make sure that my patient is going to take the medication. That's basically the purpose. You're not lying to them because I'm not asking you to lie. That is not something that I would do. But if you don't know, it's better not to get involved. But if I give you some information, it's to use it for you and for your patients, but in a very discreet way. Remember that you are a medical assistant. Sometimes you not get involved in many things, just explaining them, as a patient, as yourself being a patient. That's how I get through things. Because if I don't identify myself, if I don't put myself on the place of my patients, they're not going to get it. They're going to see me as a doctor and explaining them in terms as a doctor. Oh, well, the FDA and this is how well. They don't, well, it's just that they don't pay no mind to that. Tell me that this medication actually works, that this is the same, but in different terms. Believe me, that will do the work. So drug sources, plants, animals, minerals, synthetic and genetically engineered or biologics. Well, let's talk about each one of them. Because remember, you're familiar with plants, probably you're not familiar with animals, getting from the animal something that is going to be good as a drug, but it is. Plants, you're more familiar to plants because there are different herbs, different drugs, medications that comes from there. And you can get this, somewhere else. You don't need to get it directly from the medication. That's a different issue, remember. So once again, these other type of medications that are um, prepared, manufactured, but certain companies, they are not FDA approved. So that means, hey, you might be in deep trouble if you take these herbs or these beverage or these whatever other medications other people do. So be careful with that, like kind of home remedies, so to speak. So that's basically what it is. Plants. There are many plants that have been used as a source to get medications. So once again, it can be used, the roots can be used, the leaves can be used, the fruits can be used, the branches or stems can be used, a lot of things. Now, these plants go through process versus whatever someone else is selling you. They selling you directly the leaves, the rough stuff, the roots, the rough stuff. So you're going to get things that are good, but you're going to get other stuff right there. The plants that is being used for the pharmaceutical companies, they remove the chemical that they need from that particular leaf, from that particular branch, from that particular fruit, from that particular anything. So that is basically what it is. So you see, it's a lot easier to be seen it that way because it's like meticulously, like very, very detailed process. Because the plant can have many things. Are all those things that you are ingesting by doing something with the leaves, with the roots, and drinking it or eating it, you put in a lot of stuff in your system. And you put in stuff that you probably don't need it, probably that is going to be toxic, probably is going to be contraindicated for something that you have or some medication that you're taking. So that is basically what it is. There are some samples over there. We're not going to go over that because you don't need to know about these medications. These medications are a little complicated. But these medications in general can be used for the cardiovascular system. They can use as antiseptics. They can be used as a replacement of hormones and so on and so forth. So they can be used for a lot. Plants have lots of sources, chemicals in there that we can extract. Remember, extracting is removing what we need and separating all these chemicals because they cannot be taken all together. Other than that, you see the pharmaceutical companies just selling us a bunch of roots or leaves or flowers and eat it and prepare it, do whatever you want, that some of the medication is going to be there. No, it's going to be extracted from the plants, meaning we're going to remove only what we need. Everything else is going to be put aside. Animals, from animals, we have very, very few medications that we get from there. So that's basically what it is. And remember when we said animals is from fluids, animal fluids, tissues, organs, glands, anything that we can, extract from those organs or tissues from animals or from the body fluids that can be used for certain purposes. So that's basically what it is. Once again, we are not going to discuss exactly what medications because there are several medications from plants. There are tons of medications. It's just for you to understand the concept that the plants can be used to extract drugs, animals as well, minerals. Of course, this is one of the larger sources of, medications because think about we have all these minerals like the minerals that shows on the periodic table like calcium, magnesium, iron, zinc, sulfur, and so on and so forth. So all those things are very important. So we get it from the minerals, but they are extract because alongside of certain minerals, we're going to encounter something else. So we're going to remove it. We're just going to get what we need. So that's basically what it is. So that will be minerals. Synthetic. These are artificially modified. So some of them, synthetic means sometimes it's not even completely human, completely animal, completely plants, completely from minerals. It's just a combination of things plus artificial flavor, so to speak. So that's basically what it is. So whatever we cannot get in nature, they do it synthetically, something that is very similar that it looks like, that might act like, because the body doesn't recognize it. The body doesn't recognize whether this medication was extracted from a plant, from an animal, from minerals, or was artificially modified or made. That is not how it works. So the body is going to receive it. As long as it does the work, remember, it goes to the same process for the FDA to be approved this medication to come to the market, regardless whether it's from animals, minerals, plants, or is artificially modified by humans, by the pharmaceutical company. Still, once again, it's got to go to the same process of monitoring, evaluation, research, trials. So that's basically how it is. Nobody's going to ask you about these type of medications. Not even they're going to ask you where these medications come from, what are the sources of the drugs. It's just for you to know that we have different sources when we can get medications from. But it has a process, and very long process, and very expensive process. Genetically engineered pharmaceuticals. Now, once again, this is part of, the humans. This is when we utilize the DNA, the genes from a human person to transfer it to another person, to replace whatever damage they have with the DNA. We're going to pass it to the other ones. But once again, this has to be very, very detailed and, with people who knows what they're doing, scientific people, scientists. So that's basically how it is. So when we talk about genes, DNA, that has to do with the genetically engineered, because it's through the genes, remember. So that's basically how it works. Biologics, now these have to do with the vaccines. See, biologics have to do with vaccines. It's a little similar to the genetically engineered, because we're going to get like the plasma. Remember, you're probably familiar with this, that we use the human plasma, the person who have the COVID, and use the plasma and separate the COVID from there and create the vaccine. That's how it's done. So now we have like a live vaccine, because we're getting it directly from the person who had the virus, and we're going to isolate it through body fluids, through blood, processing the blood, getting it from the plasma. So that's basically what it is. So vaccines are a clear example of this. It says right there, from blood and blood products. So that's basically what it is. So there are many, for many conditions. See, we have one biologic for Crohn's disease, for arthritis. So there are certainties for certain types of cancers. Remember, cancers are genetic, most of them. If your family member, if you have a family member that has cancer of this particular type, chances are one of the offsprings are going to develop cancer. It's going to develop arthritis. It's going to develop Crohn's disease, because these conditions are hereditary. So that's basically how it is. But we're not going to get into more details, because this is just for you to know these terms, remember. But fortunately, you're not gonna get this on your exam. It's just for you to know where these medications are come from. Because sometimes we take medications, but we don't know these medications where it comes from. Where is the medication extracted from? Now, it doesn't matter anyways. The most important thing is that the medication work for, the intended purpose that relieves or cures whatever, was intended to it. Drug legislation. Now, there are different legislations for anything. Remember, we have laws, we have regulations. So that's basically what it is. So we have all legal drugs controlled by the Federal Food and Drug Cosmetic Act. Remember, FDA does not stand only for, Food Drug Administration. No, we was add something else because cosmetics now are part of what the FDA needs to approve. A cosmetic that is not approved by the FDA, you probably cannot sue. You probably cannot do anything if you got an adverse effect or a reaction. Or you develop something really bad after applying these cosmetics. If it's not applied for the FDA, why? Because the FDA monitors all these drugs, all these medications, because cosmetics are chemicals, are compounds of chemicals, meaning chemicals put together to produce some effects on your body for certain conditions. Even though to make you look younger or better, whatever the case may be. But these are chemicals that you can apply in your living tissue that can have consequences. So that's basically what it is. So what does the FDA actually do? It protects the purity of the medication, of the drug, because it's extracted. It's not given to you as it was found in nature. The strength means whatever was extracted, the amount of this medication is going to be due the effect that is intended. The composition, what it's made of, what else it was added to it. If you see medications have different colors, that color is not a medication. That's something extra to give a different presentation, so to speak, to the medication. But it has to be evaluated by the FDA. The composition also has to do with what chemicals can be added together. Because remember, certain chemicals you cannot put together. So the FDA monitors from day one the pharmaceutical company that is about to create, to manufacture these particular medications or cosmetics. So that's basically what it is. So the FDA is responsible for that. It reinforces that. Remember, purity, strength, composition. That is very crucial for the end product. Because if someone is not monitoring what is put on these medications, anybody can add anything, just can put a filler there. No, we cannot just put fillers without being approved by the FDA. And the FDA is not just someone sitting over there giving orders. No, the FDA is made up by all these scientists, people that knows about medications. FDA is just a name, but it is a large group of people who knows about medications, chemicals, compounds, all that. Think about an attorney. If an attorney is going to defend you, has to be an attorney who's specialized on that particular branch of whatever problem that you are in. If I'm going to buy an apartment, I'm going to get a real estate attorney because specialize on real estate. They know the ins and outs of all the processes that entails to buy or to sell a property. If I kill someone, I have to get an attorney that is a criminal defendant, an attorney who's going to defend me and knows about the criminal law. I'm not going to get a real estate attorney, a family attorney. That's not going to work. The same goes with the FDA. They're going to get people who knows exactly what they're monitoring when the pharmaceutical company is manufacturing this, is trying to come out to the market with a new medication. Now, the pharmaceutical company not only approve medications to come out to the market, but they also remove medications that are causing side effects, adverse reactions to the patients. Many medications have been removed from the market. The pharmaceutical companies have been sued. You probably heard news. So again, that's the job of the FDA. The FDA is like a legal department. It's like the military department. It's protecting the public from, the pharmaceutical companies. So that's how it works. Very, very important. Control substance. Now, think about this control. That means that these medications, these drugs needs to be controlled. That's basically what it is. These are not medications that any doctor is going to be prescribing. Remember, they need a DEA license to prescribe certain medications that are abusive, addictive. So when a medication has the potential to be abuse or to cause addiction, that falls into the controlled substance medications. So that's basically what it is. So these medications are controlled from day one. From the moment that this medication it is manufactured, because the pharmaceutical company is going to tell the FDA, I'm trying to manufacture this medication for this purpose. And you got to tell me everything because you have the chemical formula. So you got to tell the FDA everything about the medication. What is it that you're trying to do? Think about you're going to go to the school for this program. You go to the school and you find out everything that you need to know about the program. It's not like, oh, yeah, they are offering this medical assistant program and I'm going to just jump in. No, you probably did some research, not as extensive as the FDA do, but that's basically how it works. So they're going to find out, okay, what is within this medication. Remember, the compounding. What is this medication is going to be made of? Where are you going to get these resources? Where are you going to get? It is from plants, it is from this. Where are you going to get it? So they need to go over every single detail. How are you gonna sell it? What is the name that you're gonna give to this medication? What is the purpose? What is this medication? What system this medication is gonna work in? So anything that you intend to do with this medication, you need to tell what is the purpose. So that is how it works. It is very complex. It's not something that is taken lightly. Medications are very serious. Remember, you're putting inside your body a bunch of chemicals. Even though if after all these studies, this medication is still giving me side effects, adverse reactions, can you imagine without doing all these trials, all this research, all this monitoring, can you imagine what we would be putting inside our bodies? So the FDA have a very hard work to do, very extensive, very detailed. Any questions about anything that we have covered up to now? I think that we got to the time. So tomorrow we're going to talk about this, the EA, and all what it entails for controlled substances. Remember, this is very important because that will be a question on your exam. If I don't tell you a little story, whatever is going on with the medications, you're not going to understand it. So I'm just going to be reading, and probably you can read better than me. So the key point is to explain it to you so you can understand. So that's basically what it is. All right. So any questions before we call it?
Professor, when do we receive our test results from the last test?
Okay, so I'm working on it because I'm still waiting for some people that have not submitted the test. But
Okay.
it will be before the end of this week. Okay?
Okay.
No problem. All right, so then everybody have a good
Professor,
night.
I have to
No.
submit mine again because I think it didn't went through.
Okay, so remember, try to send your test through my personal email. Don't send it through the email of the school because sometimes we have problems.
Okay. Okay.
Yeah.
All right. Thank you.
Just send it through the same email that I send you, and then because sometimes when you send it through Outlook is I don't want to talk about that, but
Okay.
it is troublesome with Outlook. I've been having a lot of troubles, not now, forever, and they
All
have
right.
not fixed the problem. So no worries, just send it back to me, okay?
All right. Thank you.
You're welcome. Okay, so anybody else? Good night, everyone. Get some rest, stay warm. Thank you so much for attending the class. I will be seeing you tomorrow, same
See you
time,
soon.
same location, same
Thank you,
channel.
Professor.
You're welcome. Take care.
Good night.
Good night.
Good night. And same instructor for now.